In this video, we're going to talk about the pitfalls of significant weight loss and how, for many patients, the only option after such weight loss is surgical, and actually the surgery is complicated and not without its own problems. If you've been to the channel before, then welcome back. If you're new to the channel, then very much welcome. Today we're going to discuss significant weight loss. Obesity is a huge problem across the world. 45% of American adults are classed as obese or severely obese, and 35% of British people are the same, and it's spreading throughout the Far East and Europe as well. And it's a disease that affects potentially 1 billion people across the world. The good news is, for these patients, there are an increasing number of options to help them with weight loss. The diet and exercise industry is obviously the first step on their recovery, but we now have Ozempic or wegovy, this hunger suppressing injection, which is spectacularly effective and is probably going to be one of the most valuable drug developments over the last 20 years. It suppresses the appetite and has a very rapid and profound effect on people's body shape. Further up the treatment ladder, we have gastric surgery, which includes sleeves and balloons, and in the most extreme cases we have stomach resection or gastric reduction. These treatments again require an operation and a general anesthetic and are typically reserved for the most obese patients, but again can be profoundly effective, leading to a huge degree of weight loss. Unfortunately, it's not all good news, because we often see patients who have lost a huge amount of weight who unfortunately are no happier than they were before they lost the weight. They're certainly fitter and healthier. Their life expectancy and their requirements from the healthcare system in their country are less, but unfortunately the problem that they are left with is huge amounts of excess skin, which has been stretched and then relaxed due to the changes in weight. With some of the more interventional treatments, we often see patients who've lost 50% or more of their body weight. This can represent, in quite common cases, 100 kilos or 10 stone. The difficulty is that in any patient losing this amount of weight, then there will be skin excess. Skin excess is created when the skin, having its elastic recall exceeded. What I mean by this, simply speaking, is the skin can stretch as long as the stretch is slow and limited, but once that stretchability is exceeded, then the skin just becomes inelastic. A classic example of this is stretch marks. These are something you see more commonly in 40-year-old mothers than in 20-year-old mothers, and unfortunately the elastic properties of the skin decrease with age. What this means is that patients in their 20s can maybe lose 10 or 20% of their body weight without having significant skin elasticity, stretch marks and skin excess, but the older you get, the less amount of weight gain you can tolerate before the skin gives up. In patients over 40 or 50, even a 10% weight loss will result in this skin excess. And unfortunately, once the skin is in excess, then the only real treatment is surgical removal. We're going to go on to talk about the different areas which are subject to skin excess and how we can manage them. Going from the top of the body down, the face, thankfully, is usually very well preserved. It has the best blood supply, the best quality skin, and in many patients it is quite resilient to significant weight gain. Also, for most patients, the weight gain is not isolated to the face, but is more commonly lower down the body. We do, however, see the neck responding poorly to weight gain and then subsequent weight loss. And once the neck is sagging, then the only effective treatment, in my experience, is some kind of face or neck lift surgery. Now, this is quite interventional, but can be very effective, but is not something that most 25-year-old patients would tolerate. Thankfully, this is not typically a problem for the young patients, but very much is so for those in their 40s and 50s, and is something to bear in mind if you're considering significant weight loss. The next area to discuss is the arms. We've all seen patients who are older in life, and even if they haven't lost a significant amount of weight, they have a little bit of flabby extra skin hanging below their arms when they hold their arms out sideways. And if those patients have lost 20, 30, 40% of their body weight, then this skin is likely to be quite excessive. We often see stretch marks and poor quality skin. The only effective treatment is to remove the skin and any extra fat. There are a number of other treatments suggested, even liposuction or energy delivery tightening, but unfortunately none of these are effective enough for significant weight loss patients. An arm lift is the treatment of choice, which can be very effective but leaves scars along the entire length of the arm corresponding to the skin excess, and these scars are never invisible. Having said that, this is a reasonable treatment option, but is expensive, has significant recovery, and has its own set of complications. The next area I'd like to discuss is the breast. In young patients, the breast is made up almost entirely of glandular tissue, and glandular tissue is not fat, but the older the patient gets, then the more the glandular tissue is replaced by fat. As you can imagine, the more the breast is made of fat, then the more it responds to weight gain and subsequent weight loss, and the breasts can be extremely saggy in patients who've lost a significant amount of weight after the age of 30 or certainly 40. For these patients, the only treatment is again surgery. Now this involves removing the excess skin, tightening the skin envelope around what remains of the gland, and in many cases can involve an implant to fill the excess skin that can't easily be tightened. All of these surgeries require significant scarring, and as we mentioned in another video, then one operation for a sagging breast is almost never enough. It's the kind of problem that needs secondary operations for additional tightening or replacement of implants or removal of implants, and so you are committed to a course of probably 2 or 3 surgeries if you find yourself in the position where your breast sags due to significant weight loss. The next area we come to is the abdomen. Patients who typically carry their weight in a central distribution, this is men but also very much females, will develop a significant overhang of skin over the top of the belt line. Once these patients lose a significant amount of weight, then it's very common for this weight to be lost around this area, leaving them with a flap of skin which cannot be exercised away. That is the problem for all of these skin excesses. Patients hope that the gym will be the answer to their problems, but no amount of gym will tighten the skin once it's lost its own elasticity. For excess abdominal skin, again, the only treatment is surgery. This comes in the way of an abdominoplasty, or if the excess is significant in the midline as well as above the belt line, then a fleur-de-lis abdominoplasty. These are large operations with significant recovery and time off work. They cannot be performed unless all pregnancies are completed, because the skin will unfortunately only stretch again if there is a pregnancy and will not spring back for the reasons we've described earlier. And so an abdominoplasty would need to be performed again if there was a pregnancy after the primary surgery. These surgeries are not without their complications, mostly associated with wound healing, and leave scars which can be very noticeable, especially in the case of a fleur-de-lis abdominoplasty. Moving further down, the buttocks become saggy. A phrase in plastic surgery we use is ptotic. Now, buttock ptosis means that the buttocks look squared off, they look saggy, there's no pertness to them, and in this specific case, then the only treatment is surgical. No amount of toning will address a significantly ptotic buttock, although in the very early stage, training is an option. The surgical options are either a buttock lift, which leaves a large scar across the belt line down to the natal cleft, or a belt lipectomy, which is more commonly performed in men. These again are significant surgeries, quite similar to an abdominoplasty in terms of size, but because the incision is on the back, then mobility can be significantly compromised. Your ability to drive and do most jobs would be compromised for between 4 and 6 weeks, and although the scars can be well hidden in most clothing, it's still a very large operation to put yourself through. Even in cases where the weight loss is minor, then cellulite can be the result. Cellulite is where the fibrous adhesions between the skin and the deep layers remain, but the inflated tissue deflates, and so we get the classic cellulite appearance. Unfortunately, this is a very difficult problem to treat, because once the skin can't spring back, then the only effective treatment is either subsequent weight gain, which is not what we'd recommend, or some degree of surgical intervention, none of which are particularly satisfactory. The last area I want to discuss is the upper thighs. Now, the difficulty with thighs is that they are classically cone shaped, and if you imagine skin excess on a cone, it's very much like a sports sock which slides down your leg, and so the excess, even though it's at the top of the thighs, ends up looking more noticeable around the middle and lower thighs and the knee. The only treatment for this operation is some kind of thigh lift. Liposuction alone is very unlikely to tighten any degree of skin excess, and the thighs are very prone to losing their skin elasticity very early on in the weight gain loss cycle. surgical. Thigh lift scars are noticeable. The operation is quite significant in terms of time of surgery and time of recovery. And as in all operations, there is a long list of complications which can slow down healing and create prolonged disability. Similar to the other surgeries we've described, then it's difficult to drive and it's difficult to do any physical type of job or exercise while you're recovering from this surgery. And in my experience, the results from thigh lift are modest at best unless the patient is very carefully chosen. This is a site where even after surgical correction, many patients are left disappointed, especially if they have a lot of skin excess draping down towards the knee. In the plus column, we often find that patients who have previously been heavy are very fit. They are good candidates for surgery as long as they've lost the weight, because they're used to going to the gym every day, carrying the extra weight around, and so they tend to do well in the surgical recovery period. In my experience, the best areas for surgery are the face and neck, number one. I think the abdomen does very well. Number two, I think the results from arm lift surgery can be very good as long as the scars settle well, although the scars are never invisible. The results from breast improvement, breast uplift surgery can be good, although the breast never looks like a young breast, as it's very difficult to tighten the skin envelope adequately even with an implant. For me, the worst two areas following significant weight loss tightening are the buttocks, and then the bottom of the list is thigh lift surgery. The best advice I can give is think very seriously about gaining weight that will not easily come off with diet and exercise alone. This is even more important if you get beyond your 30s or certainly 40s. Keep athletic, keep toned, keep fit, because for the vast majority of patients, the upside of losing this huge amount of weight is counterbalanced by the disappointment associated with significant additional surgery that's required to give them anything like a normal body back again. If you enjoyed this video, then please have a look at our YouTube channel, where we have a number of other videos, including some new ones in the Problem With series. By all means, like, subscribe, and leave a comment so that we know how you feel, and tell us if there's any topics that you would like us to cover in the future. Hopefully see you on the next one.